What does informed scent for fluoxetine, otherwise known as Prozac, look like? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I've been going through a series where each day I go through one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. And I've gotten the request for fluoxetine multiple times, so I'm going to go through that one today. So fluoxetine is one of our selective serotonin reuptake inhibitors. It's actually the oldest one. And so like the other SSRIs, it acts by functionally increasing the available serotonin in your brain cells. It's FDA approved for major depressive disorder, PMDD, OCD, bulimia nervosa, as well as panic disorder. And it's often used off-label for other psychiatric diagnoses, things like generalized anxiety disorder, borderline personality disorder, PTSD. And there's also some potential medical indications. So it can be used for premature ejaculation, or if someone is hypersexual and they need to dampen that down. There's also some evidence for its use in migraine prophylaxis. Now, the side effects are going to be similar to all of the SSRIs. So this can include things like headache, dizziness, stomach upset. We generally do recommend taking this type of medication with food to help mitigate this side effect. Prozac tends to be more activating than the other SSRIs. So generally, I recommend that someone takes this in the morning. There can be a slightly increased risk of bleeding as well as sexual side effects. As with all the SSRIs, there's also the risk of SI, particularly in adolescent populations. Some things that are unique to fluoxetine include, one, that it is more activating, two, that it also has a very long half-life. And so this can be good for patients who maybe have trouble taking a medication every day. You can actually dose it once a week and you're still going to have a steady state in your system. Like most of the SSRIs, there is a risk of QTC prolongation, so we do recommend having an up-to-date EKG if you're taking this medication. So this long half-life has historically made fluoxetine easier to get off of. So in contrast to some of the other SSRIs like Paxil, where you may notice withdrawal effects after missing just one dose or even taking it late, fluoxetine, because it can last for 2 weeks in your system, is less likely to cause those withdrawal effects. However, we previously thought that, you could just switch from another SSRI to fluoxetine and then you don't have to taper it. You can just take a couple doses and then stop because of the long half-life. But we've since learned that that really is not effective. You can certainly still experience withdrawal symptoms from fluoxetine, and it can be a really confusing picture with fluoxetine because you might not notice these withdrawal symptoms until several weeks after you've stopped it. And so that can make it hard to tie back to the fluoxetine. Like any SSRI, the longer you're taking this medication, the more challenging it can be to get off of. And so for patients who have been on this type of medication for a long time, I recommend going through a hyperbolic taper, the rate of which can depend on that individual's tolerance. Otherwise, you do have risks of things like protracted withdrawal akathisia, and a whole host of other symptoms. So after going through all this information, I would answer any questions and we would decide whether or not the benefits of this medication outweigh the risks for that individual. If there's another medication that you want to hear me go through the informed consent process for, then put it in the comments below. Wishing you all good mental health, and I'll see you in the next one.